Hello, welcome. Do you know worm infestation or helminthiasis can result in a life-threatening condition if not prevented? Helminthiasis can be caused by either hookworm, pinworm, roundworm, threadworm, or guinea worm. In all these, the best way is to protect yourself from worms, so join me as I delve into the preventive measures and medication options for intestinal worms. But first, watch this before I start. Viewers' discretion is advised. This video is a boy infected with worms. The infestation was severe, so the boy needed a surgery for doctors to remove the matured worms from his intestines. Before I begin, let's educate ourselves on worm infestation or helminthiasis. It is a parasitic infection that happens when worms infect the intestines and other parts of the body. These tiny creatures, invisible to the naked eye, find their way into our bodies through contaminated food, water, or soil. And since there is no vaccine for worm infestation, no one is immune to the threat of helminthiasis. When it comes to the symptoms of helminthiasis, it can vary widely, from mild discomfort to severe complications. Some include abdominal pain, nausea, diarrhea, blood and protein loss, rectal prolapse, physical and cognitive growth retardation, and itchiness at the anal area in children. It's very necessary to seek medical attention if you suspect you've been infected. When it comes to diagnosis, worm infestation can be readily diagnosed by detection of worm eggs in stool samples using microscopic techniques. In the battle against worm infestations, prevention is our strongest weapon. It all starts with proper hygiene at home, washing your hands with soap and water before handling food, and ensuring that all fruits and vegetables are thoroughly washed and cleaned before consumption. Access to clean water is essential, especially in rural areas. Installing water filtration systems or boiling water before drinking can help eliminate the harmful parasitic worms. Cooking food thoroughly, especially meat, poultry, and seafood, can kill any potential worm larvae or egg, hence reducing the risk of infestation. In some cases, especially in high-risk areas, periodic deworming treatments, that is mostly every 3 months, is recommended. Or you can visit the health facility for a proper prescription by healthcare professionals to rid the body of any existing parasites. When it comes to the choice of medications for worms, mebendazole and albendazole is always recommended because it can be taken periodically. These drugs work by preventing the worms from absorbing the sugars they need for survival. They kill the worms but not the eggs. Also, praziquantel and ivermectin medication for worms treatment work by paralyzing the worms in the intestine. In conclusion, prevention is key. Simple steps like washing hands before eating, properly cooking your food, and avoiding contact with contaminated soil can help reduce the risk of infection. With all these, deworming is very important, so make sure you routinely visit the health facility for helminthiasis treatment or go to any over-counter medication sellers for albendazole or mebendazole, respectively. By following these simple preventive measures, you can protect yourself and your loved ones from the harmful effects of worm infestations. Thank you. I will see you in the next video.